Stanley Chia. I'm a cardiologist at Asian Heart and Vascular Center. I'm practicing at Mount Elizabeth Medical Center, Mount Elizabeth Novena Specialist Center, and Glen Eagles Medical Center. My subspecialty interest is in interventional cardiology. In particular, I have a keen interest in managing patients with complex coronary artery disease and acute coronary syndrome, also known as heart attacks.
Hello, my name is Dr. Chong Hiok. I am a cardiologist working with Asia Heart and Vascular Center. My specialty is interventional cardiology. That is to say, I specialize in doing stenting and ballooning and basically opening up of a blocked artery.
Percutaneous Coronary Intervention, or PCI, is a minimally invasive procedure to open coronary arteries that are narrowed or blocked by the build-up of atherosclerotic plaque without requiring open heart surgery. The narrowing of the arteries in the heart is known as coronary artery disease, or CAD. The build-up of plaque causes your arteries to harden and get narrower, which decreases blood flow to your heart. As a result, your heart does not get the blood, oxygen, and nutrients it needs, which can lead to chest pain or other symptoms. In some cases, it can even lead to a heart attack. PCI may be used to relieve symptoms of coronary artery disease or to reduce heart damage during or after a heart attack. The appropriateness of PCI use depends on many factors. You may need PCI if you have coronary stenosis or narrowing that is greater than 70%, or if you are still having anginal symptoms that are unresponsive to medication. If you have a history of high cholesterol, diabetes, smoking, high blood pressure, obesity, or a family history of premature coronary artery disease, you will be at an increased risk of developing a blockage in your coronary arteries. And as you get older, the chance of developing coronary artery diseases also increase. For ladies, those who have reached menopause will have a greater chance of developing coronary artery disease. Percutaneous coronary intervention is a procedure that is performed through an artery in your groin, arm, or wrist, just around here. Usually, local anesthetic is administered. General anesthesia is generally not necessary. You may receive a sedative to help you relax. However, you can also choose to be fully awake during the procedure, depending on how you feel. During the procedure, a very long, slender tube will be inserted from the wrist all the way to the heart, and the doctor may pass a small balloon with a rod stand at the tip of the catheter to the side of the blockage, and this is used to widen the blocked artery. And after the artery is stretched, the balloon is deflated and removed. If you have several blockages, the procedure may be repeated at each site. Therefore, PCI uses this balloon tip catheter to open the blocked blood vessel to restore the blood flow to the heart.
Okay, when you come for your procedure, so you will be admitted on the first day. Your procedure will be done on the first day. After your procedure, you will be admitted to high dependency unit or the intensive care unit. You will stay there overnight, and the next day you'll be discharged. Nowadays, we tend to do our procedure through your wrist. Therefore, there will be no impediment to you walking straight after the procedure. The wound takes about 2 weeks to heal completely. Therefore, for the first 2 weeks, try not to carry heavy object on your hand. Try not to do simple things like playing games, for example, badminton, bowling, lifting weight. Don't even play your musical instrument for the first 2 weeks. After 2 weeks, you can go back to your normal lifestyle. After the procedure, while you can go back to your normal lifestyle, you really should not be smoking if you were a smoker. Also, just as important, you should continue with all your medicine. The medicine will prevent clots forming inside your stent, as well as preventing more cholesterol buildup in your arteries. Things like driving, you certainly have no problem with. Your doctor upon discharge will give you a date to come for a revisit. During the revisit, we will go through your test result, we'll go through what happened during the procedure. If at the first instance during the procedure you were not shown the picture or the cine film, we can show you all that, explain to you as well as your relatives what was done to your arteries. So when you come back to clinic, we will check that the medicine that you have been taking, you have not had any adverse reaction and you have been compliant with your medicine. Okay, so now your arteries are open. You do not want to have a repeat procedure, I'm sure. Diet is very often overemphasized and exercise underemphasized. So most people will say you don't eat this or you should not be eating that. However, nobody actually tells you to exercise. Now, exercise is one of the most important things you should do, because when you exercise, you train not just your heart, but the rest of your muscle to become more efficient in pulling out oxygen from the blood. So somebody who exercises regularly, he can tolerate a more severe degree of narrowing of the arteries. There's less likely to get heart attack. In fact, it's been repeatedly shown that exercise decreases death rate as well as cancer occurrence. So exercise is one thing you really should try to do. And the best exercise is one that you like and one that you can continue doing on a regular basis. The other important thing, of course, that you should do is make sure you take your medicine regularly. Now, very often, having to take medicine for such a long time, you may forget the occasional dose. That's okay, you don't have to worry. But if you miss your morning dose, remember to take it in the afternoon. Stop smoking, exercise, watch your diet, take your medicine, and then remember to come back to see your doctor on regular follow-ups.